Have you ever felt that strange mix of hope and confusion when you start losing weight, only to find your joints hurting more than before? One of my patients once told me she felt betrayed by her own body. She said, "Dr. Carter, I'm finally doing something good for myself. Why does it feel like I'm getting worse?" I want you to imagine this for a moment. You're trying to take control of your health. You're eating better, moving more, and doing everything you were told to do. Yet every step, every bend, every simple moment of standing up seems to come with a sharper ache. It can make anyone wonder if something is falling apart inside. As someone who has cared for older adults for decades, I've seen this pattern more times than I can count. Joint pain during weight loss is far more common than most people realize, and the surprising part is that very few patients ever hear a clear explanation for why it happens. Not because doctors want to hide anything, but because this discomfort is often a natural part of the body adjusting to rapid changes. When weight shifts, your joints, muscles, and connective tissues have to relearn how to support you. It's a bit like moving furniture in a house. Things creak and strain before they settle into their new position. In this video, we're going to talk openly about what really causes joint pain to flare up when you start losing weight. We'll explore the hidden triggers that most people overlook and the small but common mistakes that make the pain worse. We'll look at how inflammation can temporarily rise even when your habits are improving, why your joints may feel unstable during the early stages of weight loss, and how to manage all of this safely so you can keep making progress. Most importantly, we'll talk about the truths many seniors never hear, the ones that finally make everything click into place. I hope you stay with me until the end, because understanding what your body is trying to tell you can change the entire direction of your journey. Even at 60, 70, or beyond, your joints have an incredible ability to adapt and recover when given the right support. And if you find value in what we're sharing today, don't forget to subscribe, like, and share the Senior Health Daily channel so we can keep growing this community together. When we talk about joint pain that appears or worsens during weight loss, people often expect a single, simple explanation. But the truth is more layered than that. After decades of working with thousands of older adults, I've realized that this type of pain is not a sign of failure. It's a sign of transition. And transitions, especially the physical ones, rarely happen without turbulence. I want to take you through each layer in a way that feels like we're sitting together in my clinic, talking honestly, openly, without fear. Not as doctor and patient, but as two people who both know that aging is a privilege and maintaining our health is an act of courage. Let's begin with something most seniors never hear about: the hidden triggers that show up during weight loss. Hidden joint pain triggers during weight loss. One of the most surprising things about losing weight is how the body reacts in the first few pounds. Most seniors believe that losing weight should instantly make their joints feel lighter, but in reality, the opposite often happens. When the body starts breaking down stored fat, it releases free fatty acids into the bloodstream. These fatty acids can temporarily increase inflammation, especially in joints that already have wear and tear. It's a biological ripple effect that very few people talk about. Another trigger comes from the fact that the body tends to lose muscle faster than it loses fat in the early stages of weight loss. Muscle tissue is what stabilizes your joints, so when you lose muscle, your joints suddenly lose their support system. The result is unexpected pressure, especially on the knees, hips, and lower back. Many of my patients come in saying, "Why do I feel weaker even though I'm eating healthier?" And the simple answer is that muscle loss always happens before your body starts tapping into deeper fat stores. A third trigger involves the changes in padding around the joints. When weight drops quickly, the protective fat layer around major joints can thin out faster than expected. Without that cushioning, ordinary movements feel more jarring. A walk around the block becomes uncomfortable. Getting out of a chair brings a sharp ache. Even lying down on one side for too long can make the hip throb. Over 30 years of clinical practice have shown me the same pattern again and again. More than 70% of seniors report an increase in joint pain when they lose the first 4 to 8 pounds. Not because something is wrong, but because the body is adjusting to a new internal landscape. And like any shift in terrain, there is friction before there is balance. Why joints hurt more when losing weight? As your weight changes, your body's center of gravity shifts with it. That shift is small but significant. Your knees and hips suddenly have to handle force in new directions, and the muscles that support your gait and posture must relearn how to work together. It's almost like learning to walk again, but on a microscopic level. For older adults, this is even more noticeable. Our tendons and ligaments naturally lose elasticity with age, so they don't stretch or adjust as easily as they once did. When the body begins to redistribute weight, these tissues struggle to adapt quickly. The result is temporary overload. You may feel a pulling sensation in the knee, a dull ache in the hip, or a sense of weakness around the ankle. Simple science can explain a lot of this. For every pound of fat you lose, you relieve about 4 pounds of pressure from your knees. That sounds wonderful, and long-term, it truly is. But what people don't realize is that these same joints can become temporarily unstable during the early phases of weight loss. That instability creates micro-movements within the joint that irritate nerves and connective tissue. The pain you feel is part of that adjustment period. It is your body recalibrating, not breaking down. In fact, many seniors tell me that their pain isn't constant. It comes and goes. It appears during certain movements, but not others. That inconsistency is one of the clearest signs that the pain is transitional, not degenerative. It's the body learning to operate under new conditions. The truth about joint pain flare-ups that doctors rarely explain. Most people panic when joint pain gets worse during weight loss. They assume arthritis is accelerating or their cartilage is thinning faster, but that's rarely the case. What you're experiencing is something we call realignment pain. As your weight changes, your posture shifts, your stride length changes, the angle of your hips adjusts, and even your foot placement can subtly transform. Your body is correcting years of compensation patterns, and as these patterns shift, your muscles and joints have to renegotiate their roles. This renegotiation causes soreness. It's the price of realignment. And once the body finishes readjusting, you come out stronger and more stable than before. Other factors can make these flare-ups worse. Sleep deprivation can amplify pain signals. Stress increases inflammatory chemicals in the bloodstream. Dehydration causes cartilage to dry out, making joint surfaces rougher. When you combine all of these with active weight loss, flare-ups aren't just possible. They're expected. This is why many seniors tell me that the pain comes in waves. Some days feel wonderful, others feel stiff and discouraging. But that fluctuation is part of the journey toward better joint health. The key is to understand that these flare-ups are not warnings to stop. They are signs that the body is engaged in deep internal work. Weight loss mistakes that make joint pain worse. Now let's talk about something that can truly sabotage progress: the mistakes that intensify joint pain during weight loss. One of the biggest mistakes is extreme calorie restriction. When you cut your intake too aggressively, your body cannibalizes muscle for fuel. Losing muscle means losing the scaffolding that holds your joints in place. Without that support, every step becomes harder. Another mistake is walking too much too soon. Walking is healthy, but the joints of older adults don't always handle sudden increases in distance or speed. If your stride is off, or your shoes don't provide proper alignment, your joints start absorbing the impact. Skipping warm-ups is another silent culprit. Older joints need time to lubricate and warm before activity. Without that warm-up, movements feel sharp and unforgiving. Protein deficiency is also common among seniors trying to lose weight. Protein repairs the muscle microtears that occur during exercise. Without enough protein, your body can't rebuild, which makes joints feel unstable and sore. And perhaps the most overlooked mistake is not drinking enough water. Dehydration thickens joint fluid and makes cartilage less elastic, increasing friction every time you move. If what I'm sharing resonates with you and you want more guidance like this, take a moment to like this video, subscribe, and share the Senior Health Daily channel with someone who needs it. It helps our community grow and gives us the encouragement to bring more life-changing information your way. Why inflammation spikes during weight loss? Inflammation is a word that scares many people, especially seniors. But not all inflammation is dangerous. During weight loss, inflammation can temporarily rise as your fat cells release stored chemicals into your bloodstream. This release is similar to shaking up a dusty attic. The dust rises before the air clears. Older adults tend to process this inflammation more slowly due to natural changes in circulation and cellular repair mechanisms. So while younger people might experience mild soreness for a few days, older adults may feel it for weeks. When I tell patients that inflammation during weight loss is normal, they often feel relieved. It helps them understand that their bodies are not failing them. In fact, this temporary inflammation is a sign that fat loss is actively occurring. The key is managing it properly through hydration, sleep, movement, and nutrition. Think of it as a remodeling project inside your body. When a construction crew tears down old walls, things get messy before they get beautiful again. Your joints go through the same process. Joint pain warning signs seniors often miss. It's important to understand the difference between normal weight loss-related joint pain and something more concerning. Many seniors forget that starting a new workout routine can trigger soreness in joints that haven't moved this way in years. Pain in one side of the body often points to posture imbalances. Morning stiffness that lasts longer than 30 minutes may signal the need for deeper evaluation. Weight loss pain tends to be diffuse, mild to moderate, and improves over time. Pathological pain tends to worsen progressively and comes with swelling, redness, warmth, or a feeling of instability. Recognizing these differences helps seniors stay calm and confident. Panic makes everything worse. Understanding makes everything manageable. Doctor-avoided truths about joint pain during weight loss. There are certain truths that don't get discussed often in medical offices, not because they're controversial, but because appointments are short and explanations take time. The first truth is that losing weight too quickly almost always increases joint pain before decreasing it. Rapid shifts create instability and inflammation. The second truth is that doing exercises incorrectly is more damaging than doing very little exercise. Form matters more than intensity. Another truth is that eating too few calories accelerates muscle loss, which is disastrous for joint support. There is also the truth that some foods marketed as healthy can increase inflammation in older adults, especially those high in added sugars or processed oils. And finally, pain during weight loss isn't a signal to stop. It's a signal to adjust. There's a huge difference between quitting and modifying. Joint pain warning signs seniors often miss. It's important to understand the difference between normal weight loss-related joint pain and something more concerning. Many seniors forget that starting a new workout routine can trigger soreness in joints that haven't moved this way in years. Pain in one side of the body often points to posture imbalances. Morning stiffness that lasts longer than 30 minutes may signal the need for deeper evaluation. Weight loss pain tends to be diffuse, mild to moderate, and improves over time. Pathological pain tends to worsen progressively and comes with swelling, redness, warmth, or a feeling of instability. Recognizing these differences helps seniors stay calm and confident. Panic makes everything worse. Understanding makes everything manageable. Doctor-avoided truths about joint pain during weight loss. There are certain truths that don't get discussed often in medical offices, not because they're controversial, but because appointments are short and explanations take time. The first truth is that losing weight too quickly almost always increases joint pain before decreasing it. Rapid shifts create instability and inflammation. The second truth is that doing exercises incorrectly is more damaging than doing very little exercise. Form matters more than intensity. Another truth is that eating too few calories accelerates muscle loss, which is disastrous for joint support. There is also the truth that some foods marketed as healthy can increase inflammation in older adults, especially those high in added sugars or processed oils. And finally, pain during weight loss isn't a signal to stop. It's a signal to adjust. There's a huge difference between quitting and modifying. How weight loss impacts aging joints. Weight loss has profound long-term benefits, especially for seniors. Reducing body weight decreases pressure, lowers inflammation, and improves mobility. But the short-term discomfort can be confusing. In the early weeks, joints may feel unstable as the body redistributes force. Muscles may feel weaker before they get stronger. Inflammation may flare before it fades. Imagine an old wooden chair that's been in the same spot for decades. When you move it to a new place, it creaks and groans. But once it settles, it becomes more stable than before. That's exactly how aging joints respond to weight loss. Your body isn't fighting you. It's rearranging itself so it can serve you better. Surprising causes of joint pain during weight loss. Beyond the obvious factors, there are hidden causes that most seniors never consider. Low omega-3 levels can increase inflammation and slow recovery. Mineral deficiencies like magnesium and potassium can cause cramping and joint weakness. Wearing shoes that don't match your new posture can throw off alignment. As the belly shrinks, your posture subtly changes, sometimes causing the hips to tilt and joints to strain. A weak core can allow the pelvis to collapse inward, making the knees absorb more pressure. These small details matter because the body works as a chain. When one link weakens or shifts, the entire chain feels the effect. Senior joint pain myths that need to be corrected. There are myths that keep seniors stuck in fear. One of the biggest myths is that pain means the joint is deteriorating. In most weight loss cases, the opposite is true. Pain means the body is adapting. Another myth is that older adults shouldn't lift weights. Light resistance training is one of the best ways to stabilize joints. Many believe that they must stop exercising at the first sign of discomfort. But easing into movement is better than stopping altogether. And finally, many assume that medication is the only solution, but strengthening, nutrition, hydration, and gentle movement often accomplish far more. As we come to the end of this journey together, I want you to take a gentle breath and let something settle inside you. The joint pain you may feel during weight loss is not a sign of decline. It is not your body falling apart. It is your body reshaping itself, recalibrating with wisdom, doing exactly what it was designed to do. What feels like discomfort is often the sound of healing beginning, not ending. Understanding this gives you power. When you know what is happening inside your body, you no longer walk with fear. You walk with intention. You move with clarity. You stop blaming yourself or assuming the worst, and you start trusting the process. Knowledge becomes the foundation that keeps you steady during the hard days, and confidence becomes the fuel that helps you keep going. And through it all, I hope you never forget to appreciate the body you live in. This body has carried you through decades of joy, challenge, loss, love, and transformation. It has stayed with you through every season of your life. It deserves patience. It deserves kindness. It deserves to be spoken to and cared for the way you would care for someone you love. There is so much hope ahead. Even at 60, 70, or beyond, your joints are capable of adapting and thriving. Your muscles can grow stronger. Your balance can improve. Your pain can soften. Small, steady changes add up in ways that surprise you. Healing doesn't happen in a single leap. It happens in quiet, persistent steps. Thank you for spending this time with me. And remember, you never have to walk this path alone. Senior Health Daily is here with you, cheering for you, guiding you, and reminding you that your healthiest years can still be ahead. If this message touched you, please subscribe, like, and share so we can continue growing this community together. Your journey matters, and I'm honored to be part of it.